My doctor told me pain with sex is normal and I said I just have to live with it after pregnancy. This is not true. This is not something that, you should have to live with.
I'm here with Dr. Cabeca Kapadia at the Pelvic Medical Rehabilitation Center. And if you can't tell, she is actually the perfect model for today's discussion on pregnancy and also postpartum pregnancy issues, the pelvic pain that we can have for 20, 30 years, but we don't want to. We're going to resolve that right away. So it's great to be here with you.
Thank you for having me, Dr. Anna.
Thank you. Now tell our audience a little bit about how you got involved in pelvic rehabilitation medicine.
Yeah, so I'm a physiatrist, so I do pelvic or physical medicine and rehabilitation. And throughout my career, I was doing, all neuromuscular medicine, focusing on the entire body. But having gone through pelvic floor issues myself in the past, and then seeing so many men and women struggle with it and not really having great adequate care, I came across pelvic rehab medicine, and I delved into it about a year and a half ago, and it's been great, treating and helping patients with chronic pain, and just really focusing one-on-one with them, spending more time with them to get to know their journey and their story, to make a really focused program of treatment for them.
Yeah, so it is a powerful area and a very new emerging field to help both men and women who are dealing with chronic pelvic pain, something that we don't want to talk about. And we mentioned in our first segment with Dr. Allison Shakande about, the shame that goes with it. We feel, for men, they may feel emasculated by talking about pelvic pain or erectile dysfunction issues. For women, that we've cut off this part of us because it doesn't give us pleasure. It brings us pain, or we've had this amazing baby. Shouldn't we be happy, satisfied? So I am sitting on the exam table talking to Dr. Kapadia here today. But as a patient, as an obstetrician, when I had my first daughter, Amanda Claire, and she was a big baby, over 8 pounds, and I did not want an episiotomy, but what I suffered with was a significant anterior tear that caused me pain for over a year. I couldn't be touched. It was so painful. It's not something I'd learned about in medical school or even obstetric residency program. But what I learned from my own experience is that downward pressure is so important, and prepping your perineum and your pelvis for pregnancy is critically important. So I'm going to touch on that a minute to say, if you are pregnant, we're going to definitely address issues ahead of time so that you're not suffering with many of the pelvic pain consequences from childbirth that Dr. K is going to go into in just a moment. So, pelvic floor massage, you could use coconut oil. You can massage the perineum to really help strengthen and stretch those muscles. Do your pelvic floor exercises. And I'm telling you, yoga is game changing to open up the pelvis, to help with the flexibility of the joints around the pelvis. That is game changing. So when we're doing yoga, we're really opening the pelvic floor, especially in squats. And then the stretching, the lower extremity, and just moving the joints around. It is probably the best exercise to do in pregnancy that I've ever experienced. So I learned that after pregnancy number 1. I was a residency. I was working 80 to 100 hours a week on call, sleeping at the hospital. My exercise life was pretty non-existent other than running rounds around the hospital. So that's it. All right, Dr. K, let's talk about some of the things that you see with pelvic floor function issues.
Yeah, definitely. So you touched on yoga and the perineal massage, and those two definitely benefit pre-pregnancy, but there are also treatments and mechanisms we use to improve blood flow and healing after pregnancy in some of the issues that we'll talk about. Here at Pelvic Rehab Medicine, the two biggest issues we see postpartum are tailbone pain, so coccydynia, and the other one is pain with sex. And it's very heartbreaking to hear my female patients say, my doctor told me pain with sex is normal and that I just have to live with it after pregnancy. I mean, you delivered a baby, so of course you're going to have pain. But this is not true. This is not something that, you should have to live with. And so kind of going back to the tailbone pain, we work on really relaxing the rectal muscles, which are directly connected to the tailbone, preventing constipation, which can kind of exacerbate that tailbone pain. And then also working on just kind of restructuring and realigning the sacroiliac joint and the iliac bones that Dr. Shrikande was talking about, and just kind of helping that tailbone stabilize after pregnancy.
So when you're talking, that's a lot of what pelvic floor therapy will do too. And what kind of treatments do they give you? Or do they do internal pelvic floor therapy, like with fingers in the vagina or the rectum?
Yes, great question. So when we send you to pelvic therapy as part of the treatment, we always recommend specific exercises, both external and internal. So when we say external work, we're talking about working on the hips and the back and the spine, the pubic area, the pubic symphysis joints, where all of those areas shift during pregnancy as the uterus expands. And so that's the external side of just the musculoskeletal healing. And of course, the internal side is a major part of healing as well. So we recommend vaginal and rectal mobilization. So the goal here would be to really provide blood flow back to that area that has been compromised during delivery.
That is so key, because again, remember, childbirth, even just carrying a pregnancy, there can be tears in the fascia that you can't see. You don't have to have had an episiotomy or a C-section to suffer from scarring internally through childbirth. And with that, the area of the vulva, the perineum, the vaginal area is abundant in blood supply, and it decreases with nerve damage, with scarring. Certainly as we get older with hormonal changes, that blood supply decreases. So we have to do things to keep it active. What builds blood supply? Muscles, but not hypertonic muscles. We want good functioning,
exactly,
strong muscles.
And after delivery, your muscles can be weak, but can also be tight at the same time. When you have tight spastic muscles, over time, that blood flow just gets cut off to that area. And you can imagine that if you have less blood flow to that area, you're going to have less oxygen and less healing of those muscles. So what we really recommend is working on remobilizing those muscles and providing mobility, especially for our female patients and our new moms that have torn during delivery, and at their 6-week postpartum follow-up, they're told, well, your stitches are healing well, everything looks great, you're on your way. But they're still having nerve pain and muscular inflammation, and that's what's causing the pain with intercourse. I mean, you can imagine when those muscles are just so tight and it looks like the city of Manhattan where nothing can get through, you try penetrating in that and it's going to naturally be painful. So we work on remobilizing those muscles through finger therapy with the therapist as well as the patient's partner, as well as we use dilator therapy. So we use dilators to really stretch those muscles out and rewire those muscles and nerves to communicate properly so that you can have comfortable intercourse. And intercourse is one area, but even pain going to the bathroom, pain having a bowel movement, all of these things are wired by the pudendal nerve that's really coming from the back and going into that vaginal and that rectal area, and rewiring the muscles in the pudendal nerve helps to kind of help the patient's pain.
Yeah, and rare but often a complaint that I've heard is pain with orgasm. So it's just painful to have an orgasm, and that is that misfiring of the nerves.
Yes, definitely. Orgasms, if you think about it, and for our male patients, erections and ejaculation, these things function based off of blood flow. So you can imagine that when you have an orgasm, your blood flow increases to that area temporarily. But if those muscles are so tight and you can't get adequate blood flow, that's what makes the orgasm painful. And so really loosening up those muscles and mobilizing those muscles for the first 6 weeks. And then we have you come back and we kind of re-examine you. And then when we send you back to the therapist, that second half of therapy really focuses on, now that we've mobilized those muscles, we want the muscles and the nerves communicating. So that's what we call neuromuscular reeducation.
That's beautiful. This episode of the show is sponsored by Julva. Julva is an all-natural anti-aging cosmetic cream for your delicate feminine parts, created by triple board certified OBGYN Dr. Anna Cabeca. If you want to stop embarrassing urine leaks, reduce vaginal discomfort and dryness, and reignite your intimate relationship, try Julva today at dranna.com and use the code SHOW10 to get 10% off your first order. Well, all right. So someone's listening and they're experiencing, or they've, having pelvic floor pain, and they're having that, pain with urination, or, pain with bowel movements, or pain with intercourse. What should their process be, their next steps be?
Yeah, definitely. So it's obviously important to follow up with your gynecologist who has delivered your baby and really done, whether there were stitches or whether there was a specific healing process, to follow up with them. And at that point, you really want to ask your gynecologist, advocate for yourself, to refer you to a pelvic floor physical therapist. I always tell my patients, in the country of France, pelvic floor physical therapy.
I'm so glad you brought this up. Yes.
Yeah, it is required that all women who have delivered a baby go to physical therapy they give you up to 6 months. And that's something that, unfortunately in this country, we kind of put pelvic floor therapy on the back burner, especially when you have a newborn and you're so focused on postpartum care and trying to take care of multiple things at once. But physical therapy is something you want to ask your gynecologist to refer you to, and specifically pelvic floor physical therapy, where they will really help to release those tight tissues and repair that blood flow after vaginal or a C-section. Because after a C-section, you have scar tissue developing and you have tightness. And there's something called diastasis recti, where the muscles of your abdomen can split during delivery. And that can be very painful and uncomfortable. So really advocating to fight to get into pelvic floor physical therapy would be the first step.
Because many women will suffer with the rectus, diastasis for the rest of their lives. But there are things that can be done to improve that and to really reconnect those muscles.
Your therapist will work on kind of closing that gap that occurs during delivery. And improving diastasis recti can also help with pubic symphysis pain, because there's less pressure in that area. And also there's so many other modalities your physical therapist will work with and give you, like dilator therapy and wearing a belt to improve that pubic symphysis, the alignment of those bones, and just really focusing on realigning that whole pelvic floor and remobilizing and cutting out that inflammation that's occurred during delivery.
Yeah. Well, I have to tell you, when I heard that France, encourages pelvic floor therapy and covers it for 6 months postpartum, there's so much that we can be doing more of in our country. And it comes with every one of you advocating for this, right? Every one of you being aware of it, speaking up with your voice, expressing yourself. If you're having discomfort, if you're having pain with intercourse, with your difficulties with constipation, we should never be constipated. And that means not having a bowel movement every day. If you're not having a bowel movement every day, you are constipated. So, and then bladder issues, incontinence, urgency, interstitial cystitis, all of this has a neuromuscular component that we can address, and it does take an integrative approach. So I want you all to advocate for yourself, and let's kind of start a petition. Let me know. You guys want to start a petition for us to get pelvic therapy for our postpartum moms in the US? I am with you on that. Thank you for watching this video. Be sure to subscribe to my YouTube channel here and get those notifications, and comment below. Let me know your thoughts, what you loved, and what your action step is.